I'm a faculty member in the UNC Department of Surgery, and I'm here to talk to you about the Capstone Project. We'd like to recruit a team to do an evaluation of a safe teen driver program in Cleveland County. There are 3 organizations. Okay. I didn't go to the school, so I'm not used to it. Try that. No? It's not moving. Okay, this works. Sorry. There are 3 organizations involved in this, and there's and that's because we have very different skill sets. The Cleveland Regional Medical Center is the site that's actually putting on the teen driver program. Mike Berenger is the trauma medical director there, and he is very enthusiastic about this program, and he actually asked about 4 years ago to have it evaluated, but we haven't had the resources to do that. I'm trained in data analysis, database development, and do a lot of SAS programming, so if you're interested in learning SAS, that's one of the things you can gain from this. The Injury Prevention Research Center has a lot of expertise in evaluation of programs. I can help with the analysis, but they can actually help people learn how to design evaluations. So we decided we would team together. The Medical Center in Cleveland County is a level 3 trauma center. They've been running this program for about 5 years, well, more than that now. They've been running it since 2005. Every 16-year-old in the county, in Cleveland County, goes through this training program. So, but it started in 2005. So we have a cohort pre-2005 that have never been through the training, and a group of people in 2005 forward who have been through the training. And what we want to do is to look at the differences and to see whether this program is really working. The significance of the problem. There are approximately 7 teens that die every day from motor vehicle collision injuries. That's a lot of kids. It's the 4th leading cause of non-fatal injuries for teenagers. And just in Cleveland County alone, there were 1,182 people involved in crashes. These aren't just teenagers, but 1,182 people. And 230 of these people were injured. But all of those people are impacted by the crashes. Even if you're not injured, you may lose your car, you may not be able to go to work for a few days. So there are a tremendous number of people who are affected by this. And there are some deaths. There are not many deaths, thankfully, but there are some people who die from the crashes. So the project goal is to do an evaluation of this program. That the program is designed to reduce teen driver motor vehicle crashes. And we want to know, is it working, and how do we make it better? And the way the program is designed now is that it tries to reduce risky behaviors in general. So part of the program is geared towards specifically toward motor vehicle crashes, but part of it is to get kids out of the watch this mentality, and they do things like, I don't know if you read the Zit comic, but snowboarding off of roofs. So we're trying to, in general, reduce risky behavior. It also, what we're trying to do is establish a greater norm of, I really shouldn't be doing the watch this behaviors within the 16-year-olds in Cleveland County. Right now, the program reaches all 16-year-olds in Cleveland County, but if we can either improve the program, if we can demonstrate that the program is working or improve it so that it works in the future, we'd like to expand this across the state. In that case, we're hitting about 125,000 16-year-olds every year, which also means that there are a whole lot of people who are above 16 who are not going to get hit by the 16-year-olds when they are in a motor vehicle collision. So I think in the long run, it would benefit many more people than that, and their parents' insurance. So deliverables. The first one is an evaluation plan. We have some ideas. We have quantitative data, we have crash data, and we have medical data. We think that there probably needs to be a qualitative component of this, but we don't know what it is, and we need help in developing that. Once you develop the plan, we want you to implement it. So we need a report on what you think of the program and how well it's working. We would like recommendations on how we can make the program better. And then I'd like to have you put together a presentation material, so in part so we can take it out and talk to people about how well this program is working, but we also want to offer opportunities to you to present this to different groups of people. I'm a contractor at Carolinas Healthcare. I work within the administrative piece of Carolinas Healthcare. There would be opportunities to present within the Carolinas higher up administrative system. There are also opportunities for present within UNC Department of Surgery because I'm here. So there are a number of places where you can present and get exposure to some of the healthcare systems within the state. Skills to be gained. Assessment. You're going to be assessing and evaluating a project. Program planning, because we want you to look at what's going to be, what can improve the program. We want you to help us figure out how to disseminate the work that you're doing. Data analysis and interpretation, I am happy to work with people in learning how to do data analysis and how to do SAS programming. I'm a geek at heart. And that's it. I think I'm